You'll often hear people saying, including us, that Medicare Advantage plans compete for your business because Medicare Advantage plans are offered by private carriers. So what exactly does compete for your business mean? What is it that they want? Well, the sad truth is they want your money, but how far are they willing to go to get it? Hi there, as always, please make sure to subscribe to stay up to date, especially with the AEP just around the corner. And of course, please make sure to like this video, give us a thumbs up so that we can get this very important information out there. Now, if you have questions about Medicare Advantage, Medicare, health insurance in general, you can reach us in the comments below, but you can also reach us at the number on the screen. We are licensed nationwide and there is absolutely no charge for our services. Now, today we're going to be talking about some of the half-truths that you may have heard about Medicare Advantage plans or some common misconceptions surrounding Medicare Advantage plans. However, please be aware that even though Medicare Advantage plans may not be for everybody, they're definitely great solutions for some people. And as we always say, it's very important that you make the right health insurance decisions for your needs. Medicare Advantage plans are also known as Part C plans and sometimes referred to as managed care plans. More on that later in the video. They're actually a replacement for Original Medicare. So you can't actually have Original Medicare and a Medicare Advantage plan at the same time. Now, Medicare Advantage plans must offer at least the same benefits as Original Medicare. However, very often they offer lower copays and lower deductibles, additional benefits, and they will impose an out-of-pocket maximum, which is not offered by Original Medicare. Medicare Advantage plans also have special needs plans like D-SNPs, which are dual eligibility special needs plans for those who are eligible for Medicaid and Medicare, and C-SNPs, which are chronic illness special needs plans. So are Medicare Advantage plans free? No, they are absolutely not free. Many plans will claim to be free or say that they have a $0 monthly premium. But if you look in that fine print, at the very least you need to continue to pay for Medicare Part B. So how does this work if Medicare Advantage plans offer lower deductibles, lower copays, additional benefits, and you may or may not have to pay pretty much exactly what you were paying for Original Medicare alone? Well, basically, Original Medicare is paying these Medicare Advantage plans to take on your risk as a Medicare beneficiary. But there are definitely downsides. With that being said, if Medicare Advantage plans were really all they were cracked up to be and were able to deliver on all of their promises, they would really be a great option. So what exactly are the downsides? Well, let's talk about some other common misconceptions. First, there's the issue of networks. So Medicare Advantage plans can offer HMOs or PPOs. And as you probably know, PPOs will give you way more flexibility. But is this as much flexibility as an Original Medicare plan? First, let's compare and contrast HMOs versus PPOs just to give you a better idea. HMOs, of course, only have in-network coverage, so your doctor or hospital must accept your plan. PPOs will provide coverage in and out of network, although if you choose an in-network doctor or hospital, it will be at a lower cost than out-of-network. With an HMO, you must have a primary care physician, which is a PCP. A PPO, it's not required. Also, an HMO requires a referral from your PCP to see a specialist. That's not a requirement for PPOs. And then usually you'll notice that HMOs have lower premiums and PPOs tend to have slightly higher premiums. So yes, of course, PPOs will give you much more flexibility. You'll be able to go in and out of network. But it's still not quite the same as Original Medicare, which has no networks. And that is because Medicare Advantage plans are known as managed care plans, which means your insurance has a say in which treatments or services may be authorized. And this is the issue of pre-authorization. That's why many doctors and specialists choose not to contract with Medicare Advantage plans. And as an aside, it may be pretty easy to find a PCP or primary care physician who accepts a Medicare Advantage plan, but it can be much more difficult to find a specialist who does. So make sure to check and compare that when comparing plans as well. But back to the issue of pre-authorization. What exactly is pre-authorization? Well, basically, it's an additional roadblock between you and your care if your insurance carrier and your plan is something known as a managed care plan, meaning that if your doctor recommends that you receive a certain treatment or service, your insurance plan may still have to pre-authorize it in order to ensure that you are covered. This can mean longer waiting times, many phone calls, and possibly ultimately denials or major medical bills. So if you ask us, pre-authorization is one of the biggest reasons to not get a Medicare Advantage plan. Finally, another huge and possibly empty sales pitch has to do with those extra benefits. So yes, Medicare Advantage plans may offer additional benefits to appeal to beneficiaries. So things like dental, vision, hearing, prescription drug, and many, many more. However, are these extra benefits really enough to entice you away from the more comprehensive coverage offered by Original Medicare and a Medicare Supplement plan? Probably not. You may be thinking, but I'm not spending any more money and I get dental and prescription drug included. Well, let's dial it back and take a look at what might be included. For example, let's say that your Medicare Advantage plan offers dental coverage, but it's a DHMO, otherwise known as a dental HMO. Proceed with caution. It may be difficult to find a dentist that you like who accepts your dental plan. And if that's the case, then this is a benefit that really isn't serving you at all. We've got videos dedicated to dental insurance and the differences between DHMOs and PPOs. But just to encapsulate it really briefly, a lot of people report dissatisfaction with their dentists who operate within a DHMO, possibly because of the way those dentists bill. They often feel rushed through their services. And let's say that your Medicare Advantage plan offers prescription drug coverage. Well, that's great. Is your prescription covered? How much does it cost? What is the deductible? Is there a separate deductible for the prescription drug aspect of the plan versus the medical deductible? So it's not to say that these extra benefits aren't great. They may certainly be, especially if you live in Florida where Medicare Advantage plans sort of are much better than in other areas of the country. But you need to make sure that these plans and the benefits that they offer will serve you not just at face value, but look a lot deeper to make sure that the plans really serve your needs. If you do choose to go the Medicare Advantage route, remember the AEP is every year from October 15th to December 7th, so it's right around the corner if you are interested in signing up. Especially if you're going to go the Medicare Advantage route, we highly recommend that you work with a broker to help you work through the ins and outs of your plan and understand the specifics. Also, make sure to review your plan every year during the AEP to make sure it's still the best plan for you. As always, please make sure to subscribe to stay up to date, especially with that AEP just around the corner. And please like this video so that we can get this information out there. So, do you have a Medicare Advantage plan? Is it something that has served you, or have you heard horror stories? Please let us know in the comments below. Or of course, if you have any questions or videos you'd like to see, you can let us know there as well. You can also reach us at the number on the screen. And as a reminder, we are licensed nationwide and there is absolutely no charge for our services. Thank you so much and have a wonderful day. Bye-bye.